Welcome to Health Pedia. Today, we're exploring everything you need to know about typhoid fever. We'll cover its signs and symptoms, how it's diagnosed, the treatment options available, and crucial prevention tips. Let's get started. Typhoid fever typically begins with a high, sustained fever that can reach up to 104 degrees Fahrenheit, 40 degrees Celsius. Other common symptoms include headaches, stomach pain, and a general feeling of weakness. Some people may also experience a rash with flat, rose-colored spots. It's important to recognize these symptoms early for timely medical intervention. To diagnose typhoid fever, doctors often perform a blood test to detect the presence of Salmonella typhi bacteria. In some cases, stool, urine, or bone marrow tests may also be used. Accurate diagnosis is essential for effective treatment, as other illnesses can mimic typhoid symptoms. Typhoid fever is primarily treated with antibiotics. The choice of antibiotic depends on the strain of bacteria and its resistance patterns, so following a doctor's prescription is crucial. Along with antibiotics, supportive care such as hydration and rest is important to ensure recovery. Prevention of typhoid fever focuses on safe food and water practices. Always drink boiled or treated water, wash your hands regularly, and avoid eating raw fruits and vegetables in high-risk areas unless they are peeled and cleaned. Vaccination is also available and recommended for travelers to regions where typhoid is common. By understanding the signs, diagnosis, treatment, and prevention of typhoid fever, you can take steps to protect yourself and others. If you found this video helpful, please like, share, and subscribe to Health Pedia for more health insights. Together, let's stay informed and healthy.